Excellent. Great. Well, welcome everyone. Good morning. My name is Rita Koutsoudiamos, and I'm the Executive Director of the BC Alliance for Healthy Living. And we've partnered with Vancouver Coastal Health to host this important discussion today. So thank you so much for joining us. I'd like to start by acknowledging that today's event is being broadcast from the traditional unceded territories of the Squamish, Musqueam, and Tsleil-Waututh nations, where we have the privilege to live, work, and play. And I myself am joining from Squamish territory, and I'm very grateful to the Squamish and our neighboring Seychelles nations who've been stewards of this land forever. So I'd like to invite all of you to introduce yourself in the place where you are in the chat. And just to tell you a little bit about our event today, we are here today to discuss alcohol health and safety in a time when policies have really relaxed. And from a health perspective, this is significant as alcohol is considered a class 1 carcinogen and a causal factor in more than 200 diseases. But most people are completely unaware of that. So we know that drinks with dinners or at social gatherings are common for many adults in BC, but the prevalence and normalization of regular alcohol consumption, as well as occasional problematic use in our society, really underscores the need for effective policy measures. So we have an excellent program that's lined up, that's organized into 3 parts. First, we have some very knowledgeable speakers who are going to tell us about the evidence on alcohol and some policies, that can keep our communities safer and healthier. After their presentations, we'll go into breakout rooms to discuss policies and programs that we'd like to see in our communities. And then we'll reconvene to share some of those insights and continue the discussion. So if you have any questions for our speakers, please type them in the chat and we'll get to them either before or after the breakout sessions, depending on our timing here. So let's get started. So first off, I'd like to introduce Dr. Mark Lecision, and he is a medical health officer for the City of Vancouver and Deputy Chief Medical Officer for Vancouver Coastal Health, where he works closely with the harm reduction and population health programs. So over to you, Mark.
All right, thanks so much, Rita. So yeah, I just want to start off our session today by thanking everyone for joining, and then just by reviewing some of the harms that alcohol causes for people and for communities. So, but first I'll acknowledge that we're gathered today, or actually that Vancouver Coastal Health operates on the traditional and unceded territories of 14 First Nations, and I personally am speaking to you today from the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. So why should we care? I think a lot of people on this call probably know, but just quickly, alcohol causes harm, obviously, for the consumer. A whole list of different types of harms: cancer, heart disease, stroke, liver disease, injuries, violence. It's a significant cause of death, just doesn't make people feel good and makes them less productive, and of course can impact people's mental health and cause substance use disorder and addiction and all the problems that come with it. But sometimes I think we forget that alcohol causes harms to other people too, who may be consumers or who may really be bystanders of other people consuming alcohol. And it does that through violence, through injuries, accidental injuries, but also motor vehicle collision-related injuries, causes harassment, sexual violence, again, loss of productivity that can affect businesses and the economy in general, community safety, and then finally costs on our healthcare system and our criminal justice system. Historically, there's been a lot of focus from the public health community on tobacco, and we've really managed to I would say, turn the tide in terms of the harm that tobacco has been causing over the years. Recently, there's also been a lot of focus on cannabis as we move to legalize cannabis. And then currently, obviously, and rightfully so, there's a lot of focus on opioids. But if you look at the harms that are caused by, the harms and the costs of these different substances, you can see that alcohol outpaces, all three of those substances, all substances, in fact. And although, provinces like BC collect a lot of money from tax revenue, from the sales of alcohol, the cost to society are actually greater. So, this is not a winning proposition for governments. It's actually, a situation that they're losing money on. So, what are the current trends in BC and in our region? What we see is that consumption of alcohol in BC is actually very high and has been increasing. It's higher than any other province, in fact. And if you look at the middle line here, the brown line, that's consumption in BC. And in 2020, just prior to the pandemic, it reached its highest point since BC has been monitoring in a rigorous way. And you can see the black line underneath it is the line for the Vancouver Coastal Health region. But then I'll highlight the green line on top, which is for the Vancouver City Center local health area. And you can see that the consumption in that particular neighborhood is much higher than the provincial or regional average. And so, consumption can vary quite a bit depending on the community and the people that live in it. And, that what we know during the pandemic is also that many people increased their consumption of alcohol. And that was definitely true in many Vancouver neighborhoods and neighborhoods across the province. And you can see the Vancouver Coastal Health neighborhoods here and the increases that people reported. So, that those consumption numbers are only going to go up. We're just waiting for the kind of more timely data. And consumption occurs among adults, where drinking alcohol is legal, but it also occurs amongst youth. And you can see that, as youth get older, they're more and more likely to consume alcohol. And when they do consume alcohol, they're likely to consume it regularly. So 57% of youth who consume alcohol consumed it in the past month. And then, if they're regularly consuming it, they're also likely to consume it in problematic ways. 30% report binge drinking. And so you can see that also binge drinking continues into adulthood. It's a particularly problematic form of consumption, particularly when we think about harms to other people. And you can see the rates in Vancouver and Vancouver Coastal Health, and they're relatively high amongst all age groups. Consumption has been increasing, and then we see also that hospitalizations are increasing because the more people consume, the more likely they and other people are to be hospitalized for problems related to alcohol. And so we can see this clear trend provincially, but also in our region of increasing hospitalizations. And then finally, we see relatively high levels of death, but the consumption has been recently increasing. We're starting to see the hospitalizations, and we expect rates of death will increase in the coming years. It takes a little while for some of the types of illness to develop, like cancer and heart disease. And so although the death rates right now are relatively stable, we expect they will start going up in coming years. And so, despite these worsening kind of patterns of consumption and health harms, what we see is that governments are interested in liberalizing alcohol policy. And, so if we think back to the fight on tobacco 50 years ago, this was sort of what was happening about tobacco. There was more and more places where you could smoke, and there wasn't a lot of restrictions. And in order to kind of reverse the health harms that we were seeing, we had to increase restrictions and, in various places and in different ways. And then finally, we've seen the health harms of tobacco come down. But we're on the opposite journey for alcohol. We've built this timeline looking back to 2014, so basically 10 years, and looking at the different moves by the provincial and then also kind of the local governments in Vancouver, which are often, kind of leading the way or seen as examples to other municipalities in the province of the different ways in which alcohol regulations have been loosened. And so, it started with the province and a liquor policy review and in various ways that was liberalized. And then, it fell to municipalities to decide if they wanted to adopt some of these things, um, like wine in grocery stores or other things like that. Vancouver had been having specific problems down in the Granville Entertainment District and the downtown east side. And so they actually did introduce some regulations there, but now several years later, and I'll talk about it a bit later, they're thinking of relaxing those. During the COVID pandemic, the province and municipalities actually relaxed many of their alcohol restrictions so that people could consume in different places in different ways, so that alcohol could be delivered, with foods. And a lot of these changes, although they were enacted specifically, to kind of deal with certain problems having to do with the pandemic, they've actually been made permanent. And so they'll continue. And so we've just seen this pattern of liberalization, and we know that the more regulations are relaxed, the more people consume, and we know the more people consume, the more harms we see in society in terms of all of those health harms that mentioned. So, and this relaxing of regulations is in a context where people have extremely good access to alcohol. This map shows the location of liquor retail stores in Vancouver, and then the proportion of the population that can get to them within a 400-meter walk. That's 44%, and up to the population that can get there within a 15-minute walk is 94% of the population. And this actually increased since the last time we did this analysis about 5 years ago, but yet, recently alcohol was added to grocery store shelves in Vancouver, and we're not sure what problem people are trying to solve. People have excellent access to alcohol, retail alcohol in Vancouver. We also see that there's a correlation between liquor serving establishments and then whether people engage in binge drinking. And so you can see the location of liquor retail again, but then also liquor establishments. And you can see that where the concentration of those are, people are much more likely to engage in binge drinking. And so, these decisions around the Granville Entertainment District and the Downtown East Side Entertainment District, these have real impacts, because if we allow more establishments there, we will likely see more binge drinking. So, the recent policy changes, basically, during the pandemic, liquor store hours were extended, home delivery services were allowed. This started during the pandemic and then expanded. Alcohol consumption was also allowed in public places. This is a relatively new trend in BC. Parks, beaches, public plazas. There's been very little evaluation of these pilots, and we don't really know what kind of health harms these initiatives are causing. They're actually quite difficult to evaluate because there's so many different places and ways that people consume alcohol. And so it's hard to kind of measure the specific impact of these interventions. And then, recently Vancouver Council passed the motion allowing the sale of wine on grocery store shelves. They had previously decided that wouldn't happen in Vancouver, and now it is. We find this particularly concerning because it doesn't only affect people's access to alcohol, it also can affect the price of healthy food, because grocery retailers, of course, can lower the price of food in order to, give better or increase the price of food in order to give better prices around alcohol and outcompete with alcohol stores. So we find this particularly problematic. It's also problematic because children then have access to alcohol marketing because they're walking around grocery store shelves and things like that. And then finally, a little bit of a call to action, because we have this other decision that's going to be happening in Vancouver at the end of November, either on the 28th or the 29th. But basically, city staff have been directed to modernize existing rules with regards to liquor primary establishments, so bars and clubs. And they want to basically increase the capacity limits for the different types of permits so that the smaller venues can actually be bigger than they used to be. They want to remove the distancing requirements between establishments with the same types of licenses, both downtown, but also all throughout Vancouver. And we know that controlling the number and density of alcohol outlets is one of the best ways to reduce harm. And so this is going to remove controls on the density. They want to remove the moratoria that are currently in place in the Granville Entertainment District and Downtown Eastside Entertainment District so that there can be more of these establishments. They can be closer together, and basically there's no limit on the number that will be allowed if these moratoria are lifted. And then finally, they've also considered extending the hours of sales, because in Vancouver, most places can only serve until 3 a.m., although in BC, service till 4 a.m. is actually allowed. And we know that drinking in the late hours is particularly harmful. So we're sort of calling this out to partners. We're going to provide more information to partners, but often when these things occur in City Council, we're the only people speaking against them. And often there's a lot of people speaking in favor of them because there's business interests, there's industry interests. And so it ends up seeming like, well, I guess there's more support for this than opposition. And, then things kind of move ahead. So, thanks for attending today, and thanks for considering this call to action. And we're interested to hear your ideas about the best policies that can be implemented to help limit this health harm and turn this health emergency around. So thanks.
Oh, thanks so much, Mark. That's really compelling data that you've presented there. Yeah, it's worrisome, isn't it? Well, thank you. Next up, we have Kate Valance. And so Kate is coming to us from the, she is a research associate with the Canadian Institute for Substance Use Research at the University of Victoria. And she has managed a wide variety of alcohol and other drug research projects at both the local and national level. So I'll turn it over to you now, Kate.
Thanks, Rita. I'm really pleased to be here today. Yeah, and thanks, Mark, for that presentation. I mean, the point you made about like what is the problem with the current level of access, I think is a really good question for folks to be reflecting on. Now, okay, so just before I get started, I'm joining today from the University of Victoria, and just want to first acknowledge and respect the Lekwungen peoples on whose traditional territory the university stands, and the Songhees, Esquimalt, and Wasanic peoples whose historical relationships with the land continue to this day. And this is particularly important to acknowledge when we're talking about alcohol and other drug policies, as they have disproportionately impacted Indigenous peoples here in BC and across Canada. So as Mark asked, why should we care about alcohol and alcohol policy? There are actually lots of reasons, many compelling ones, as we heard in the last presentation. And just to provide a bit more context, in 2020, people in BC consumed the equivalent of about 10 standard drinks of alcohol per week per person aged 15 plus. And that's the equivalent for per person, not just for those who drink. And if we're talking about just folks who do consume alcohol, that's more like 14 drinks per week. So if we put that in the context of the new Canada's guidance on alcohol and health, and we've got that chart on the right there, we can see that basically means that we're off the charts in terms of increasingly high risk of alcohol-related harms. And many folks may not even be fully aware of the additional risk that comes along even with that level of consumption. As Mark mentioned, there are increasing health and social harms and costs related to alcohol. 2,600 deaths, over 14,000 years of productive life lost, 160,000 hospital admissions in BC in 2020. And then in terms of the economic impact, again, the cost of alcohol was $2.81 billion. Revenue, $2.043 billion, which means there's that deficit happening and the costs of alcohol far exceed the revenue. So the current model of using alcohol as a source of revenue for jurisdictions, the numbers just don't quite add up there. And these are just some newspaper headlines that reflect some of the trends and policy directions, both across BC at the provincial level and at the kind of municipal level in the last couple of years. And a lot of them are directly as a result of the pandemic. And of course, during the pandemic, the World Health Organization recommended tightening alcohol regulations to reduce the additional burden of alcohol harms when much of the population was stressed and anxious. However, we observed the exact opposite, relaxation of these regulations, and of course, alcohol consumption increased. And there were many policies that were put in place to ease accessibility of alcohol, like opening at 7 in the morning and things like that. And again, as Mark mentioned, they were made permanent later on. And as the policies were introduced as a way to sort of try and support community connection and local businesses, they actually, because they increase access to alcohol, they also inevitably lead to increases in alcohol harms and costs. So one of the main projects that I've been involved with here at CSER is the Canadian Alcohol Policy Evaluation, or CAPE project. And this is an ongoing research project that assesses how well provincial, territorial, and federal governments in Canada are implementing alcohol policies proven to reduce harm from alcohol use. And we just released the results from the third round of this project earlier this year, along with a new alcohol policy community practice, a national community practice. And this, the map on the left there just gives a sense of how well each of the provinces and territories did overall, and that is to say, not very well. The average score was 37%, and that was actually also the same score that the federal government received for their alcohol policies. The highest score was 44% in Manitoba, and BC scored 36%, which is just under the average. I saw some familiar names in the audience, so a lot of you are familiar with this. For those who are new to CAPE, this project uses 11 different evidence-based policy domain areas that have been shown to reduce alcohol harms at the population level as a way to assess policy implementation and adoption across the country. And you can see those domains are listed there on the right. They're listed in rank order of effectiveness and scope. It's important to know that these are federal and provincial territorial policies, but they do also have implications for municipal and local government level policies as well. So this is just a closer look at BC's CAPE results by the different policy domain areas. And again, these are provincial policies, not necessarily a reflection of municipal policies. The highest scores in BC were in the screening and treatment interventions with 62%, and in monitoring and reporting at 60%. And then the lowest score was in alcohol strategy. BC doesn't have one, so that makes sense. And marketing and advertising domain was also below 20%. So clearly lots of room for improvement in BC across the board, but especially in the 3 top weighted policy domain areas you can see, which is pricing and taxation, physical availability of alcohol, and the alcohol control system. So just as an example, the first policy domain there, pricing and taxation, BC scored 28%. It's the most heavily weighted domain in the CAPE project because policies such as alcohol-specific taxes, minimum prices in liquor stores and licensed establishments like bars and restaurants, indexing those prices so that they keep pace with inflation and aren't going down every year, and having pricing based on the alcohol or ethanol content in a beverage as opposed to just the volume of liquid. These are some of the most effective strategies that reach a really large proportion of the population and have a significant impact on reducing consumption and alcohol cause health and social harms. So, you know, as I said, BC scored 28%, so there's a lot of lost opportunity for reducing alcohol harms and costs at the provincial level. So this table just gives a bit of a sense of how a few of the different types of alcohol policies operate at the federal, provincial, and municipal levels. And this is important because, of course, reducing alcohol consumption and harms through healthy public policy requires that multi-level, multi-sectoral approach. All levels of government control elements related to the distribution, sale, and consumption of alcohol in different ways and can complement each other by working together to create a more comprehensive regulatory framework that balances local needs with wider federal and provincial objectives. So broadly speaking, federal policies set some rules for the whole of Canada, but in a lot of areas, they download that responsibility for alcohol policies to the provinces and territories. And within those parameters, the provinces will set overall rules and standards for alcohol regulation. And then within that, municipal alcohol policies can offer local governments the authority to customize and enforce regulations according to the distinct needs and characteristics of their communities. So the physical availability domain is one of the areas where municipal and local governments have some of the most important alcohol policy powers. And overall, this domain addresses how easy it is for consumers to access alcohol. And this is an important intervention at both the provincial and municipal level when it comes to preventing and reducing harms associated with alcohol. So physical availability of alcohol includes things like the density of liquor stores and on-premise establishments. So we saw those charts with the density in the downtown Vancouver area, and sort of the number of trading hours in a day, number of sale days in a week, whether liquor stores are open 7 days a week, as well as the placement of outlets, like the distance they're allowed to be from a school or a hospital, and then whether home delivery and takeout of alcohol is allowed. And there is that large evidence base showing that the greater density of liquor stores and licensed establishments selling alcohol increases both community and individual level harms, just a whole range of them. Some of them are listed on the slide there. And policies limiting the physical availability have consistently been shown to reduce alcohol-related harms. So this slide just gives a bit more detail about the state of physical availability policies at the provincial level in BC, and this is looking at the CAPE results for BC. And as we saw on that earlier slide, the overall score was 37% for this policy domain area at BC, so not a lot of strong policies in place. The density of liquor stores and licensed establishments was quite a bit higher than recommended. So there's an ideal of 2 per 10,000 liquor stores, and currently BC has 6. Where am I? Oh yeah, sales of liquor store, the hours of sale run longer than recommended. And there is that home delivery allowed, including by a third party like Uber Eats, takeout is allowed also from on-premise establishments, although it does require a food component. So just to briefly, municipal policy options. So even though provincial policies are not meeting evidence-based recommendations, municipal governments do have additional powers to create tighter restrictions, especially around the physical availability of alcohol. Often what we see is that they use those powers to loosen them, but they can actually use those to tighten the restrictions. Municipalities have control over alcohol policies for all municipal properties and venues, so things like community centers, parks, beaches, plazas, and they can also restrict the physical availability of things through licensing, land use, bylaws, zoning, development agreements, and community policing priorities and mandates. And some of the other areas municipalities can control too are things like marketing and advertising in public spaces. And of course, this is particularly important for limiting exposure to alcohol ads for children and youth. But often municipalities aren't even aware of the legal powers that are available to them to control and modify these kinds of policies. And that's where something like a municipal alcohol policy can provide a really important guiding framework. And that's where it's sort of a collection of policies specific to alcohol in a more formalized sort of suite of public policies can be used to support healthy communities and reduce alcohol harm. And so I'll leave it there on that one because Tom is going to be sharing some really valuable real world insights on developing and implementing community informed municipal alcohol policies. But just before I hand it over to him, as I mentioned, we do have this community of practice, and it now has more than 400 members from across all the provinces and territories, and includes lots of folks working at the municipal level. It's turned out to be a really valuable resource and provides lots of opportunities for knowledge sharing, connections and collaborations, and professional development. There's an event coming up at the end of the month relevant to municipal alcohol policies, presented by the Ontario Public Health Association. That's really worth checking out. So if you'd like to become a member, I think when the slides get sent around, I can also put it in the chat. There's a link to sign up for the community practice. And here at CSER, we've also put in 2 funding applications recently to be looking at municipal policies across the country. So stay tuned for that. My last slide is just an acknowledgement of the funding for CAPE. And thank you very much for being here today. Looking forward to the discussion after.
Oh, that's great. Thanks so much, Kate. Boy, if one of my kids came home with a report card like that.
Yeah, it's not pretty.
You can try so much harder. Yeah, that's terrible. So clearly we can do a lot better, can't we? So thank you so much, Kate. Next up, as Kate alluded to, we've got Councillor Tom Steer, and Councillor Steer is with the District of Tofino and has served on the Alberni-Clayoquot Regional District Board since 2020. And in his time as a local elected official, he has been a champion for healthier approaches to alcohol in his community and at other levels of government as well. So over to you, Tom.
Great. Thank you, Rita, for the introduction. And once again, my name is Tom Steer, and I'm zooming in from the traditional territories of and unceded territories of the Tloquet First Nation, of which the city of Tofino resides. And we really do like to acknowledge that generosity in sharing this incredible place that we do live. I would also like to thank, of course, the BC Alliance for Healthy Living and Vancouver Coastal Health for convening this conversation on community policies, alcohol, and safety. This is a significant issue and in our region and in our communities. And in conversation with many municipal leaders throughout the province, this issue has extreme impacts on many of the communities there. And listening to Mark, some of the challenges that come with some of the larger urban centers, such as Vancouver, in terms of municipal policy, there are some challenges still with some communities that rely on some of the revenues that may be associated with alcohol sales in their communities. I came to this issue directly from my day job as a first responder and a rescue specialist with the Canadian Coast Guard, of which about 50% in any given year of my calls are directly related to the consumption of alcohol in our communities. And most of these cases become much more problematic, as was pointed out, some of the social harms that come with that. So many of those calls are directly related to not just the physical harms associated with the binge drinking aspects of alcohol consumption within our communities. As a municipal councillor, the issue of harms of alcohol consumption in our region came to council in a presentation by our medical health officer in the region and our chief of staff at the Tofino General Hospital. And at that presentation back in 2018, it was clearly identified as the #1 public health and safety issue in our region, and exponentially so. And I can speak also to today, or I can see our medical health officer is online here, and in just recent conversations with Dr. Enns, once again, it is a significant issue in our communities to this day. So what tools and powers does a local government have to reduce harms associated with alcohol? And as Kate alluded to, one of the major policy areas that the District of Tofino looked at was municipal alcohol policy. And I do want to give a quick shout out to the amount of support that was provided by CSER and Kate and her colleagues in the development of this policy at the District of Tofino. So one of the things around developing a municipal alcohol policy is to identify what the purpose of that policy is for our community. And in Tofino, that purpose was to reduce potential harms at public events serving alcohol and to promote inclusivity at events on public property. This is important because we only have control over municipal lands. This does not apply to private properties within the community. And we wanted to clearly identify what our priorities were for introducing this municipal alcohol policy. The policy was guided by three foundational principles: community health and safety, inclusivity, and engagement and support. Community health and safety, the policy aims to promote the health and safety of all people by creating safety protocols and harm reduction tools to promote thoughtful approaches to the consumption and promotion of alcohol. And some of the key policy specifics under there were not approving applications to serve alcohol on district properties that may have some safety concerns, such as our municipal docks, our trail networks that are often in areas that could potentially be dangerous to the public. Other safety issues related to that policy were safe transportation programs for events where alcohol was to be served. We also had no last calls, separate stations for non-alcoholic drinks, notification to responding agencies such as the RCMP, EHS, and the Tofino General Hospital for events over 100 people in participation. There are a number of others within that community health and safety area. The other foundational principle, inclusivity. This policy is drafted with the intent to include people who might otherwise be excluded, marginalized at public events, and to recognize and respect the experiences of all community members. Policy specifics within there were not to approve applications in public parks. And that has a huge inclusivity factor that is sometimes not recognized in some of the cities that have enacted pilot projects to include alcohol consumption within specific public parks. Not approving applications for community events that target family and children's. And this was one that had came up around events such as Canada Day, Family Day, and other parades that we have here in Tofino. Once again, to be able to include all of those folks that would be involved in those types of celebrations. The other policy foundational principle was engagement and support. The policy and amendments will be developed by meaningfully engaging with the public and events producers to support the provision of responsible events. This was a key factor in the development of this policy. The success, I believe, of this policy was the extensive public engagement with multiple stakeholders. This ranged from event producers, RCMP, NGOs, our medical health officer, the list goes on. This was important to have those multiple stakeholders at the table because in the end, this policy became a community-owned policy. The municipal alcohol policy is only 2 years old in Tofino. We adopted it in 2021. And it has become a part of the culture for public events, serving alcohol with community acceptance and understanding. It has also provided a broader dialogue and harm reduction approach to alcohol-related issues in our community. And I will say has helped council in looking at issues of public health and safety when alcohol is involved from a much more informed position of the potential harms that are associated with alcohol consumption within our communities. Another tool, as was alluded to by Kate, is zoning, and it directly is impacted in the area of physical availability. So it is an excellent tool that we can utilize for public health strategies within our communities. Zoning, as was pointed out, can regulate where alcohol sales can be sold, the density of those. And what a specific example, it was an interesting several years ago when an application for a zoning amendment to have an allowable use of alcohol sales, and this was at a gas station that was looking at increasing sales and wanted to have an allowable use as a zoning amendment with alcohol. We reached out to the public and we asked the fundamental question, is this going to be beneficial to the community? We also looked at the number of alcohol outlets within a radius of that potential use. it was decided through great public consultation, including our medical health officer once again, that this would not be an appropriate use zoning amendment for this particular piece of property. So zoning is a powerful land planning tool that districts have, municipalities have, and especially in that specific policy domain that Kate was talking about in terms of availability. We know that is a significant factor, especially around density and availability. Another area, municipal policy tool that we have is the ability to have input into liquor license applications. In that process, municipalities have the ability to make comment and recommendations on liquor license applications to the Liquor Control and Regulation Branch, Liquor Control and Cannabis Regulation Branch. The district has submitted comments with community engagement and medical health officers, and I know our medical health officer in a recent application, very recent application, submitted comments to the Liquor Control and Regulation Branch, not in support of the application that had come forward, based on the fact of, once again, availability and proximity, as well as a number of other public health factors that were included there. So once again, it is a tool that we have utilized on an application, a primary liquor application several years back. Once again, we reached out to the community. We are required to reach out to within a 60-meter radius, but we also have the ability to extend that out and to bring in other community consultation, such as the RCMP, such as our medical health officer, to provide input into the, is this in the community's best interest from a public health and safety perspective? And I'll finish off on the one area that municipal governments have a role to play, and that is in advocacy. I'm sitting here at this forum today in this capacity once again. We have the ability to lobby at the federal, at the provincial level, and to other municipalities within British Columbia. Some of those advocacy measures, for example, at the federal level, there is a Senate bill that is being proposed by Senator Brazo. Once again, this is a bill that is going to be introduced in the Senate, is introduced at the committee level, and we have submitted letters of support. It is specific around labeling. This is one area that municipal governments can put their voice forward for those larger population level type interventions. Also at the provincial level, at UBCM, or Union of British Columbia Municipalities, where we have the ability to speak directly with ministers. The District of Tofino has spoken several times directly to ministers around the importance of public policies that will reduce at the population level harms associated with the consumption of alcohol. And once again, at the municipal level, we have the ability, and I can see some of my colleagues here on the call today, to have those direct conversations to enact those types of policies that will be beneficial to the public health of their community. There are a number of other policy areas for municipalities can be actively involved. We are at the ground level. We are the most transparent, and we can act in a very quick and timely fashion on many of these, as opposed to the federal and provincial governments, which admittedly can move at a glacial pace. So to sum up, local governments have important and significant tools to help address the harms associated with alcohol consumption. And I believe it is the responsible and clear obligation to communities' well-being from elected officials, which is required for us to perform as defined in the Community Charter and the Local Government Act. Thank you for your listening today.
Oh, thank you so much, Tom. That was really great. And I noticed, and I'll thank Kate, because there was a question about where can we find these policies and what you've done in Tofino, and she's added the link in the chat there. So that's wonderful. I also noticed that that there was a question about how you were figuring out consumption rates, Mark, but I see that you also answered that in the chat, that it is from the sales data. But there's a question here, and I invite you all, if you have other questions for our speakers, to throw them in the chat, from Kelly McDonald. Kelly, do you want to unmute and ask your question?
Hi, everybody. Thanks so much for those wonderful presentations. I loved hearing from each of the different speakers and the different perspectives. In Interior Health, we've created a toolkit for local governments that speaks about the risks of alcohol and then provides some policy recommendations that they can take. And some of those policy recommendations are around advocating for pricing and taxation increases on alcohol. And some of the feedback we've received from our Indigenous partners is that there are groups within our societies that are more prone to alcohol use, and that those groups tend to be lower income individuals, and that there is a risk when you do increase pricing and taxation on alcohol sales that you're further marginalizing groups who are already vulnerable to a higher cost of living. And how do we balance policies to make sure that we aren't hurting people who are already hurting? Thanks.
Who wants to answer that one? That's a tricky one. Oh, go ahead, Tom.
Yeah, I don't have a direct answer in terms of it is recognized clearly those challenges, certainly within the communities up here in my localized area. We live in proximity to several nations that have brought those challenges forward at the municipal level. And the one area that I think where we can be successful in helping to mitigate some of those potential harms that are associated is around those harm reduction strategies. At the District of Tofino, we've lobbied very hard for areas such as sobering and assessment centers, providing those types of interventions that will help to maybe mitigate. It is recognized clearly that there are some populations that will suffer if we increase prices in those areas. How we go about doing that is in direct consultation with those communities to advise us on what strategies may be an important element to bringing that forward. That has been a challenge for many of us in municipalities to be directly listening to those voices who have on the ground experience and be able to share with us what ideas they believe will be the most important in bringing those harm reduction potentials where areas that you've identified, Kelly, that can be impacting those communities.
And if I could add to that, it's really about coming up with the right pricing policies. Right now we have a minimum price in BC, and what that incentivizes is alcohol makers to create high strength, low cost alcohol, and then people who consume a lot of alcohol consume even more alcohol and they suffer more health harm. So it's not an equitable policy. And so what would be better is price per standard drink, where we have this minimum price that's linked to the amount of alcohol in the drink, and that way there's that incentive doesn't work, and so people who are consuming more actually end up consuming less and benefit from their health. So it's actually a more equitable policy because it affects the people who consume the most beneficially, if that makes sense. But there will be some people at the bottom ends of that policy who won't be able to afford the minimum prices. And so that's why we also need alcohol harm reduction programs, managed alcohol programs, where we can help those most vulnerable people who would turn away from beverage alcohol to non-beverage alcohol. So, so we need the programs to protect them as well. So I think it's really about coming up with the best policies that promote health equity, and then also, always making sure that we're providing harm reduction programs as well for the people kind of who need that safety net.
Great, thanks, Mark. Sarah, I see you have your hand up. I don't know if you're interested in joining in the answer or if you have another question.
I have a question, but mostly a comment. I see that we've sort of discussed the non-alcohol alcohol that people would access if they couldn't afford, liquor store alcohol. They would go to some kind of mouthwash or something like that. And I've really been interested by the maps and mapping out where access points are, because I'm also interested in the mapping of where treatment centers are, because it is about having healthy habits and having, other sort of community, having other ways of connecting with people rather than around the bar, so to speak. And I think that I'm really interested in this work as it relates to promoting healthy lifestyles rather than kind of adopting the habits of previous generations, maybe. Thank you. And I also think the question that I am interested also is about how prohibition in the past with alcohol has informed what we need to do to make effective policy. Thank you.
I mean, if I could respond to that, I would say that, you know, managed alcohol programs are in their infancy in BC, and they're kind of emerging in some communities, but they're not widely accessible to people in BC who need them. Then for the second part about those sort of kind of developing the healthier habits, you know, previously recovery services were offered by nonprofits or religious groups, or, you know, basically outside of the healthcare system. And so there's been a movement recently for the healthcare system to be involved in offering recovery services. And we've developed a model called the Junction here in Vancouver Coastal Health that has been implemented in Vancouver and soon to be implemented in North Shore, and soon to be actually scaled into a provincial program that would offer kind of a health-informed recovery model that actually wouldn't require abstinence. It would be for people at any stage of their journey. The only thing that's important is that they're committed to a journey of recovery, whatever that looks like for them, because previously the kind of abstinence-based model excluded people from trying to recover, you know, in a way that was best from them. So I think this is a kind of positive development within the healthcare system, and you know, definitely is at its infancy and needs to be expanded, but there is sort of an eye for that type of expansion that's happening, I would say.
Great. I'm just going to turn to Audrey. Audrey's asking a question about fetal alcohol syndrome disorder. Audrey, do you want to unmute and ask your question?
Sure, thanks. So just thinking about the rates of FASD and messaging the risks of alcohol in pregnancy seems to fall to a provincial responsibility. CanFASD, the research network, also has a bill in the House to have a national framework for FASD, which would include prevention and policy at all levels. So I've just been trying to think through what are the municipal responsibilities in terms of messaging and supporting women to have healthy pregnancies. So it's a complex area, and I'm not expecting a huge answer, but I just wondered if anybody had kind of tackled that at all with, or had any ideas that we could put forward. Thanks.
Kate, have you seen anything in the literature around that?
Yeah, I mean, there's a lot. Of course, Nancy Poole and her team have done a huge amount of work around FASD. I think, you know, a lot of that can be in increasing awareness. You know, we've seen in Australia and New Zealand, they now have the mandatory pregnancy warning label, and that can be at the federal level. Like you mentioned, there's that bill. I guess it's you know, the awareness piece, and they're spreading the information that way. Yeah, I mean, it's certainly something where I think it's almost one of those situations where everybody assumes everybody knows that, but then when you actually talk to people, there was a recent, I think it was the Institute of Alcohol Studies had a really great webinar around it, where they did an evaluation or analysis of I think it was Mumsnet, which is sort of a mum's website around alcohol use and what was considered risky use for women who are planning to be pregnant or are pregnant. And I think the findings were quite surprising. So, you know, there's sort of that, oh, everybody knows that, but what does that really mean? And so I think there's certainly more room for talking about it. There can be like a stigma piece attached to that as well. And so it's how do we have those conversations, and how are we sharing the responsibility for that knowledge, and looking at the kind of current normalization culture, especially with more marketing and advertising being directed at women, and specifically women of childbearing age. So, you know, it's an ongoing one that yeah, needs to be part of the picture.
For sure. Thanks, Kate. I mean, I'm aware of all of those things and have been
Mhm.
actively working with a number of groups. It's just not very often that we get the opportunity to talk to municipal folks about this issue. And on the opposite side of the coin is people with FASD who are 30 times more likely to have substance use issues and don't respond to traditional kinds of treatment programs. So one of the things that CAN FASD has done has been to develop some guidance for treatment programs around how to better serve this population so that they're not kicked out on the first day, which is usually what happens. So anyway, I'll leave it at that. I don't want to monopolize the whole meeting, and I know that other people have questions as well. So, but I thank you for the time.
Oh, thanks, Audrey. Charmaine, maybe we'll take one more question, and then I want to get us into our small group session so that we can continue some discussion as small groups. So do you have a quick question, or is it something that we can come back to?
It's a question / comment about labeling.
Okay, go ahead.
Okay, so first of all, thanks to all three of the speakers. Really appreciate what you bring. And of course, as a Defician, I have to give a special shout out of thanks to Councillor Steer for his leadership in our community. But I'm just back from the European Public Health Conference in Dublin, Ireland. Now, the Irish are some of the world's largest alcohol consumers, and Ireland is the first country to pass a law to have mandatory labeling on their alcohol. Guinness sells 10 million drinks per day. This is how much they drink. And they're going to have labeling. And in a very small label on their bottles, it's going to contain a picture of a pregnant abdomen woman with a line through it, like a red circle with a line saying, don't drink if you're pregnant. It's going to give caloric intake. It's going to give you notification that this causes liver disease and that it's directly related to fatal cancers. If Irish can do it, I don't know why we can't. And I think this actually starts to normalize, instead of the one-offs of messaging, trying to find creative ways to make sure everybody knows about all of their risks with consumption. It should be on the product. And I'm curious, because I know, Tom, you're involved at a federal level in this discussion, if you have anything to add to the conversation about how we can help move that as a population to normalize that, but also the liability that exists by not informing people of the risks with a known carcinogen. That's also another really interesting thing that we're kind of blind to in terms of the sales of the product. But I really would love to know, is this out of our hands because it's a federal decision, or is it a provincial decision, or how can we impact that?
I can take a first stab. I know that provinces are well within their powers to implement labels immediately. So is the federal government. They could actually just amend the Food and Drug Act tomorrow and do it. So it's currently winding its way through Senate because there isn't that political will to do so. Northwest Territories and Yukon both have mandatory labels, and that's a local government, that's a local directive. And so, I think there probably is room in some capacity creatively to require them at the municipal level. It's something that there, like I said, there are a lot more powers that municipal governments have that they don't necessarily know they can utilize. That's partly why we're trying to get funding to do a study that would include legal experts who can actually look at, for each of the provinces and territories, the municipal acts that actually show what room there is, because it does vary. But I wouldn't be surprised if there is a way to do that through licensing or special requirements on, at least on municipal properties for events. If you have a liquor license, that you would need to have some kind of signage. You can have mandatory signage around underage drinking and that sort of thing. So I think we'd maybe be getting creative, because as we know, like the smoking bylaws, that started from municipal level up. So it's maybe taking that approach.
Sure, Charmaine, we've
That's
even
great.
considered using the Public Health Act to share some of this information. You know, we do have the experience here in Vancouver of requiring restaurants to post warnings about consumption of raw oysters based on outbreaks that had happened here, and using the Public Health Act to force them to do that. And so, you know, we've considered whether we could do that for restaurants serving alcohol, because people aren't aware that it's a carcinogen. But, you know, sort of in order to get there, it's a long process that we'd have to do of trying to get voluntary compliance, trying to show that there's no other way to do this that's being done. And so instead, we've sort of supported the federal, you know, bill to get, you know, because we think that's the best way to get labels on alcohol. But, you know, we do have this in our back pocket and are considering, you know, what steps we have to take to get there. And it would be a long journey, and it would not be, you know, popular. It would not be well received. And, you know, so we have to do it in the right way. But so I think it's like Kate says, you know, we have to get creative, but hopefully there will be political will to do some of these things. You know, there has been political will to put warning labels on tobacco products and also even cannabis products. And so, you know, I hope that we could get there for alcohol.
Excellent. Well, it's great to see all these questions coming in. And Laura, I know you've had your hand up for a bit, but I'm going to ask you to hold on to that question until after we do, because we really want to break everybody into small groups to continue the discussion. So, but before we go, I just want to direct your attention. Twilight, do you want to throw up the link for the mural board and the questions? So we're going to break into smaller groups and continue the discussion around promising alcohol policies. What is your group working on? Where do you want to go? And what are some other some areas that you know, other considerations that you might have as well. So so Twyla has just put, if you see here, there's a link there. And if you click on that, it'll bring up a mural board. It's a whiteboard. And what we're trying to do is to populate this to get a sense from this group of what are some of the policies that people are working on. And so our questions are, what policies or programs is your organization advancing? What other promising policies would you like to see adopted? Where are the elected officials in your area standing on these issues? And for our conversation, so we're going to break into small groups. There will be a facilitator in each group. If you click on the mural board, just if you haven't done it before, don't feel like you have to create an account. There is a quick enter if you enter as a visitor, and then you'll see a board that looks like this. So you can see here, and you can increase the size of it by going on this zoom in and zoom out on the right hand bottom corner. And if you want to, there are some sticky notes that you can use, and you can just adjust the size, and you can start typing in them just like that. Just start typing. If you need to have another sticky note on the board on the left hand side there, you see this icon here, that will bring up some new stickies. You can just click on that and it'll automatically enter it onto the board, and then you can just type away. So I can see that there's already some people who've started exploring. So we're going to break into our small groups now. And if someone is having difficulty accessing the board, we'll just ask others in the group to help them out by either transcribing what they're sharing verbally, or by you know, you can enter it in the chat and then transcribe it that way. So yeah, so continue the conversation in small groups, and we'll see you back here in about 15 minutes. We are back together again, and So it looks like there's been some activity on our board here, and I'm just wondering if anybody wants to speak to what's on there. I see there's quite a bit around municipal toolkits, and if somebody put something around municipal toolkits, if they wanted to speak to that. No takers?
I got booted into this group too, and I was facilitating another group. But Rita, to your question on
Yeah.
municipal toolkits, I can just say, so all who haven't met me yet, Mike Adams, Interior Health. And I think I work with Kelly McDonald in our health community development team. And one of the things that came out of our medical health office of the medical health officer do an annual report in interior health, and one of the reports they've done the last couple of years was on alcohol and alcohol consumption in interior health, because I think we've got some of the highest consumption rates in the province as a health authority. And one of the resources that Kelly mentioned when she was asking her question was putting together a toolkit, I guess a resource toolkit, just more to inform, taking that promotion, education, awareness approach of informing about the consumption rates within our region, as well as the harms, but also including considerations for local government of approaches they could take related to I guess public consumption or alcohol consumption in public places.
Yeah.
And maybe a bit of that cultural shift of it going from, I guess, more acceptable to less acceptable, or alternatives, alternatives to what's the word I'm struggling for? Giving for those that are putting on events that maybe are not including alcohol in their event, giving them some kind of break or some kind of so I'll just stop there.
Some sort of incentive, right?
An incentive, thank you. That's
Yeah.
what I was struggling for. Thanks, Rita.
Well, Juan's group was talking about beverage alternatives to continue the what did you say, conviviality? I love that word, but
Conviviality. Yeah, I can report on
social
group one
cohesion
recently,
that comes when people gather around food and drink. But that's without the ethanol, right? So did you want to carry on with that?
Sure,
Juan?
I can just bring that up. I think also as a potentially on tap opportunity that we have working with, I guess, another setting within communities, being workplaces, and the role that alcohol plays in kind of a workplace engagement, some of the social parties that happen, and looking for alternatives there. Also looking potentially with businesses themselves for policies that could even limit their liability of using alcohol as a social lubricant, I guess, in those contexts. So yeah, I think we mentioned that one of the things we have considered in VCH, although we have been very busy with these municipal policies, but is engaging industry perhaps around looking at mocktails and other alternatives, and exploring that possibility of promoting other alternatives that will also bring people together, but are not come with the same level of harm. So yeah, just to flag that we at the local level, government level, there's still limited discussion on this type of policies, and so the untapped potential that was mentioned from the group was around workplace settings.
And as much as I support the idea of a municipal toolkit, I think, for that really to work, the province has to show leadership on this. They have to show that they're making changes at the provincial level. Oh, and here are some things you can do at the local level, but what's happened, because there are guidelines about municipal alcohol policy from the province, but as they liberalize alcohol regulations, they give these guidelines to local governments that have to now struggle to implement, to sort of clean up the mess at the local level. And so to me, that's not the right approach. You know,
Mhm.
that approach works along with provincial leadership on this.
Tom, did you want to add to that?
Yeah, I just wanted to reiterate what Mark just said, that the ability at those higher levels of government to set the pace, set the tone, to allow for those conversations. When it gets downloaded to municipalities, and don't get me wrong, that the toolkit is an incredibly important piece of work, but when it gets downloaded to municipalities with limited resources and limited jurisdictional powers, yes, we do have some. It often falls to those municipalities to pick up the slack. So I 100% agree with Mark's. The province has to show real leadership, and I would say the federal government on certain levels has to show real leadership in these areas for municipalities to be able to, and we were in our breakout group, what it takes for municipalities to enact those pieces of policy that we have the toolkits to be doing. But I just want to reiterate once again the importance for the province and the feds to show real leadership in this area. And that's why that advocacy work that we need to do at all levels, and we have to move at all levels, is critically important. It just can't be one dart from one area. It has to be a combined effort, and we have to be moving in tandem.
Very good point. I just wanted to sort of segue onto a point that Charles, I think you're still here. Charles made an interesting point around alcohol consumption, referencing some of the one of the slides that you had put up, Mark, and that, while alcohol consumption around youth is concerning, of course, but there have been a couple studies that show that it's declining in youth, and wondering about the trend lines. Charles, did you want to unmute and speak to that?
Sure. Just very quickly. Yeah, there have been a few studies that have come out recently showing that Gen Z and younger millennials are drinking less than older generations. I think part of that is due to potentially, cost of living and price increases. We know in tobacco control, for example, tobacco taxation is number one cause for reason for declining smoking rates. So there's a lot of potential movement on price sensitivity. But anyways, just wondering, generally speaking, has that been a trend that others have been seeing, that kind of the younger generations are drinking less, and potentially why, and what lessons can be learned from that?
I think our best source of data on this here in BC is the Adolescent Health Survey that's done, kind of all public high school students every 5 years in BC. And so we have sort of data on kind of what proportion of kids are trying alcohol, what age they're trying it at, and things like that. And I see two trends in that data. That the one is that the general population of youth are drinking a little bit less and are initiating a little bit later. And that's good. But there's a growing population of youth that are drinking in more high-risk ways. And this has to do with the increasing prevalence of anxiety and depression and mental health problems among young people. It's a greater and greater proportion of the population. There's still a minority of the population that have these problems, but it's a greater and greater a proportion of them. And in these same surveys, we see more and more kids saying that they're drinking alcohol to manage anxiety, to manage depression, or to kind of sensation seek because they're bored. And those are problematic ways to use alcohol. And they suggest that, those kids might be at higher risk of addiction and problematic alcohol use. So, those are the two trends I see. The general youth population that's not suffering from, mental health and addiction problems, they're getting a little bit healthier. And then this higher risk group may actually be, at higher risk, which of course they are, but that higher risk group is actually growing relative to where it was before because of these trends of depression and anxiety. So I'm a little bit worried about that group and what it's going to mean for them, even though maybe the general trend is different. So, there's sort of two different trends there. I don't know.
Well, and that is a good note for us to end on, in terms of that we still have to do better and be thinking about that report card and our next generation as well. What are the kind of conditions that we're building for a healthier next generation? So I just wanted to let everyone know that we will be taking the mural board as well as the presentations and turning that into a what we heard report that will be disseminated to all of you. So there was a lot of questions about, oh, can we get this data? Can we get this presentation? So yes, you will get that all together in a nice package wrapped up with a bow. And just want to thank you for helping us with this conversation, helping us with the policies, and thank you for each and every one of you in terms of the advocacy that you do and the work that you're doing to advance this, even if it is just talking with your community members. Huge thank you to our presenters today. To Mark and Kate and Tom, really appreciate all of the data and expertise that you brought to the conversation. And thank you to the audience for participants for engaging in a really full, rich conversation. Thanks again, and we're at the 10:30 mark, so we will let you carry on with your day. Have a wonderful day, and we'll be sending out a survey, so please do fill it out because it helps us learn from these events and how we can do better in the future. Thanks.